Hello, I'm Dr. David Thompson, and I have a story that might shock you. It's the story of Martha O'Connell, a lovely woman from upstate New York. When she first came to me 2 years ago, Martha, at just 62, was facing a future that terrified her. She was an office manager, a brilliant, active woman, but years of sitting, combined with the stress of a late-in-life menopause, had left her joints utterly ravaged. Her knee pain was so severe, so relentless, that she could barely walk from the kitchen to the living room. She was using a cane, heavily dependent on daily NSAIDs just to function, and the heartbreaking truth was, her doctor had already suggested that preparing for assisted living, or even a nursing home, was a practical next step. She feared losing her independence more than anything. Imagine that fear, the fear of becoming a burden. The fear of simply existing rather than living. But today, Martha is not just walking. She's not just independent. She just sent me a photograph from the top of a moderate hiking trail she completed with her grandchildren. She's healthy, vibrant, and completely off all her prescription pain medication. What was the magic cure? Was it a new, cutting-edge surgical procedure? Was it a powerful, expensive new drug? Absolutely not. The miracle was powered by a simple, natural method that 97% of doctors usually overlook because it doesn't come in a pill bottle or a syringe. It was the strategic use of 8 specific anti-inflammatory foods designed to do 2 things: shut down the internal fire of inflammation and provide the raw materials needed to rebuild her damaged knee cartilage. I'm here to tell you that your joint pain, your stiffness, and your fear of dependence are not a life sentence. In the next few minutes, I am going to guide you through the detailed, science-backed implementation of this very same method. We are going to turn your kitchen into your pharmacy. Now, before we dive into these 8 life-changing foods, I need to know who I'm speaking to. I want you to immediately go down to the comments right now and tell me your age/the symptom that is limiting you the most. Is it stiffness in the morning? A throbbing knee that keeps you up at night? Let me know so I can understand our community better. For those of you nodding along, thinking, well, Dr. Thompson, that's just genetics, or that's what happens when you turn 50, I have to correct you. While wear and tear is real, the severity of the pain, the rapidity of the decline, is rarely just getting old. It is, in most cases, a chronic deficiency in 3 specific nutrients that are the essential building blocks for collagen synthesis and inflammation control. If your body is running a construction site for cartilage repair, these nutrients are the construction workers, the cement, and the blueprint. Without them, the site shuts down, and the damage accelerates. My name is Dr. David Thompson. For over 30 years, I have dedicated my life not just to treating disease, but to restoring true, independent health. I've treated thousands of patients, from athletes to office workers, to new mothers struggling with postpartum joint laxity, all looking for a sustainable path to health that doesn't rely on endless prescription drugs. This channel, our community, is built on a mission: to help you live a healthy, vibrant, and independent life through the power of scientific, targeted nutrition. Everything you hear here is backed by published medical research, not fleeting health trends. I understand your fear of becoming dependent on medicine. I share your belief that your body has an innate, powerful capacity to heal. I'm here to be your guide, grounded in 3 decades of clinical success. Let's see how much your body is currently screaming for help. I want you to listen to these 5 common symptoms and tally them up mentally. Be honest with yourself. 1. Do you have significant stiffness or pain in your joints, especially knees or hands, that lasts longer than 30 minutes after you wake up? 2. Does your knee/joint ache significantly more on rainy, cold, or humid days? 3. Do you frequently experience brain fog, difficulty focusing, or general fatigue, even after a full night's sleep? 4. Do you notice that simple cuts or bruises take much longer than they used to heal completely? 5. Do you rely on over-the-counter pain relievers, like ibuprofen or acetaminophen, 3 or more times per week just to get through the day. Now, count up how many of those 5 you answered yes to, and comment that number below. That number is a direct measure of the systemic fire burning inside your body. The root cause linking all those symptoms, joint pain, brain fog, slow healing, is something we call chronic systemic inflammation. Think of inflammation like an internal forest fire. Acute inflammation is a small, necessary brush fire that helps you heal from an injury. Chronic inflammation is a slow-burning wildfire that never goes out. It constantly attacks healthy tissues, starving your joint cartilage of necessary nutrients, creating what we call ischemia, lack of blood flow, and inducing oxidative stress, which is like internal rusting. The 8 foods we're about to discuss are the firefighters, the construction crew, and the anti-rust treatment all rolled into one. Solution 1. The red gold spice, turmeric. The first food is not a food, but a powerful spice, and I call it the red gold of natural medicine, turmeric. Specifically, the compound curcumin. Let me tell you about Robert, a 55-year-old accountant from Boston. His job involved long hours hunched over a desk, and his lower back and knee pain were so bad he was considering early retirement. He started incorporating a specific turmeric preparation, the one I'll share in a moment, and after just 6 weeks, he called me jubilantly to say he was back on the golf course, walking the full 18 holes without needing his cart. Curcumin's power lies in its ability to directly block a major inflammation pathway. Think of it like this. Your body has a central control switch for inflammation called the NF-κB, nuclear factor kappa B, signaling pathway. NF-κB is what tells your body to produce all the destructive inflammatory molecules like COX-2, what NSAIDs target, and various cytokines. Curcumin is a molecular fire extinguisher that slams that NF-κB switch off. Furthermore, it's a potent antioxidant, cleaning up the cellular debris from oxidative stress. This isn't folklore. A landmark meta-analysis published in the Journal of Medicinal Food in 2016 reviewed 8 clinical trials and concluded that curcumin extract was as effective as ibuprofen in managing arthritis pain, but without the damaging side effects on the gut and kidneys. Practical guide: how to. Dosage: aim for 1 teaspoon of ground turmeric powder daily. Golden time: any time with a meal containing fat. Notes: turmeric alone is poorly absorbed. You must combine it with a pinch of black pepper. Pepper contains piperine, which boosts curcumin absorption by up to 2,000%. A simple golden paste of turmeric, black pepper, and olive oil is the perfect addition to a morning smoothie or soup. Have you ever tried a turmeric latte or golden milk? Tell me if you felt any difference. Solution 2. The cartilage builder fruit, pineapple. Next up is a tropical delight that acts as a natural demolition crew and repair squad, pineapple. Maria, a 48-year-old mother of 3 who struggled with knee pain related to multiple pregnancies, postpartum joint issues are very common, started eating pineapple daily. Her doctor had prescribed physical therapy, but the inflammation made it painful. Once she incorporated this fruit, within 2 weeks, she reported that her swelling had visibly decreased, allowing her to fully engage in her PT, and she was able to run with her kids again. The secret is an enzyme called bromelain. Bromelain is a powerful proteolytic enzyme, meaning it literally digests protein. When you have an injury or chronic inflammation, damaged proteins and cellular debris accumulate around the joint, like trash piling up in the city. Bromelain acts like the city's waste disposal unit, breaking down these inflammatory protein complexes, clearing the path for healing, and dramatically reducing swelling and bruising. The journal Evidence-Based Complementary and Alternative Medicine in 2012 published a study comparing bromelain to standard pain medication for osteoarthritis. The results showed that bromelain supplementation provided comparable pain relief and improved joint function, confirming its role as a potent, natural anti-inflammatory. Practical guide: how to. Dosage: consume about 1 cup of fresh pineapple chunks daily. Golden time: best eaten on an empty stomach, e.g., mid-morning or before dinner. This allows the bromelain to act systemically in your bloodstream rather than just helping you digest food. Notes: the highest concentration of bromelain is near the central core of the pineapple. Don't throw the core away. Blend it into a smoothie. If you eat pineapple, do you toss the core? Let me know in the comments. You might be throwing away the best part. Solution 3. The bone-strengthening bean, black beans. The third food is humble, affordable, and a powerhouse for both your joints and heart: black beans. David, a 68-year-old retired engineer, had significant pain in his hands and wrists. He loved gardening, but the constant throbbing made it unbearable. He was skeptical, but added black beans to his diet several times a week. After about 2 months, not only did his joint pain significantly lessen, but his blood pressure also improved, and he could spend hours in his garden again without needing a break or pain pills. Black beans are a triple threat. First, they are loaded with anthocyanins, powerful antioxidants that scavenge free radicals and reduce oxidative stress, the internal rust we talked about. Second, they are a fantastic source of magnesium and folate, both of which are critical for bone mineralization and the production of healthy joint tissue. Third, the high fiber helps manage weight and blood sugar, reducing the mechanical stress and metabolic inflammation that harms joints. They provide the structural integrity and the protection for your entire skeletal system. Research published in the Journal of Nutrition and Metabolism in 2017 highlighted that regular consumption of legumes, particularly black beans, significantly reduced levels of C-reactive protein, CRP, a key blood marker for systemic inflammation and joint degradation. Practical guide: how to. Dosage: aim for a half to 1 cup, cooked, 3 to 4 times per week. Golden time: best eaten with a main meal to slow the release of glucose and keep inflammation down. Notes: if you use canned beans, make sure to rinse them thoroughly to remove excess sodium, which can exacerbate fluid retention and joint swelling in some people. Do you eat beans regularly? What's your favorite bean recipe? Solution 4. The internal sunscreen oil, extra virgin olive oil, EVOO. You likely have this in your pantry, but you may not be using it correctly to fight joint pain. It is the liquid gold of the Mediterranean diet, extra virgin olive oil, EVOO. Brenda, a 52-year-old artist and former marathon runner, was devastated when knee pain forced her to stop running. She switched to high-quality EVOO as her primary fat source, using it generously. Within 3 weeks, she noticed a significant decrease in the burning, hot feeling in her joints. She was eventually able to return to brisk walking and gentle jogging. EVOO contains a remarkable compound called oleocanthal. Oleocanthal has a molecular structure strikingly similar to ibuprofen. Like ibuprofen, it acts as a non-steroidal anti-inflammatory drug, NSAID, but it is a gentle, natural version. It inhibits the COX-1 and COX-2 enzymes, directly reducing the production of pro-inflammatory chemicals. I call it your internal sunscreen because it protects your cellular structures from the inflammatory rays of oxidative damage. The journal Nature in 2005 published the groundbreaking research identifying oleocanthal and demonstrating that just 50 g, about 3.5 tablespoons, of EVOO has an anti-inflammatory effect equivalent to about 10% of the standard adult ibuprofen dose. A small, protective dose every single day. Practical guide: how to. Dosage: aim for 2 to 3 tablespoons daily. Golden time: use it both for cooking, at low to medium heat, and as a finishing oil. Notes: always choose extra virgin, EVOO, as it retains the highest level of oleocanthal. Never deep fry with it. Save high heat cooking for avocado or grapeseed oil. Drizzle it generously over salads and vegetables. How do you typically use olive oil? Are you sure it's extra virgin? Solution 5. The surprising waste filter, Veggie, broccoli. This next food is often avoided, but it's one of the most powerful foods for joint protection: broccoli. Erica, a 35-year-old postpartum woman, struggled with persistent, generalized joint pain after her second child. She had significant aches in her knees and hips. We focused on increasing her intake of cruciferous vegetables, especially broccoli. After 1 month, her hip pain was virtually gone, and her knee stiffness was dramatically reduced, allowing her to comfortably carry her infant for longer periods. Broccoli contains a potent compound called sulforaphane. This molecule is incredible because it helps your body detoxify and directly impacts cartilage breakdown. Researchers found that sulforaphane blocks the action of enzymes that destroy joint cartilage. Think of it as a molecular bodyguard protecting the collagen in your knees. It also boosts your body's natural defense systems, acting like a waste filter that cleanses inflammatory toxins. A study from the University of East Anglia and published in Arthritis and Rheumatology in 2013 found that sulforaphane significantly slowed the destruction of cartilage in models of osteoarthritis, demonstrating a direct, protective effect on joint tissue. Practical guide: how to. Dosage: aim for 1 to 2 cups of raw or lightly cooked broccoli florets 3 to 4 times a week. Golden time: eat at any time, but the preparation is key. Notes: to maximize sulforaphane, chop your broccoli and let it sit for 5 to 10 minutes before cooking. This process, called maceration, activates the necessary enzymes. Lightly steaming is better than boiling. How do you usually cook your broccoli? Try the chopping trick this week. Solution 6. The Omega Powerhouse, Fatty Fish, Salmon/Sardines. This is the most famous inflammation fighter, but it's crucial to understand why and how to get enough. Fatty fish, specifically salmon, mackerel, and sardines. Michael, a 70-year-old gentleman with classic knee and hip arthritis, was a major skeptic. He started eating salmon and sardines 4 times a week. Within 3 months, he noticed the deep ache in his joints had lessened so much that he was able to stop taking his prescribed anti-inflammatory drugs entirely, under my supervision, of course. Fatty fish are the richest source of the long-chain omega-3 fatty acids, EPA and DHA. These aren't just good fats. They are the raw materials your body uses to create anti-inflammatory chemicals, specifically called resolvins and protectins. Imagine the inflammation fire. Resolvins are molecules that actively resolve or shut down the inflammation process. They literally shift your body from a state of burning to a state of healing, helping your joints recover rather than continue to degrade. A comprehensive review in the journal Annals of the Rheumatic Diseases in 2014 confirmed that high intake of omega-3s from fish significantly reduced tender and swollen joint counts in rheumatoid arthritis patients, demonstrating its powerful therapeutic effect on inflammation. Practical guide: how to. Dosage: aim for 3 to 4 servings, 4 ounces each, of fatty fish per week. Golden time: any time with a meal. Notes: if you can't eat fish, a high-quality, third-party tested fish oil supplement is the next best choice. Look for one that provides at least 1,000 milligrams of total EPA and DHA daily. Do you prefer salmon or sardines? Be honest. Solution 7. The collagen booster herb, parsley. This herb is often just a garnish, but it is a silent giant for joint repair. Parsley. Jessica, a 58-year-old former teacher, was experiencing significant, nagging finger joint pain, a common symptom in her age group. She started adding a large handful of fresh parsley to her morning smoothie and salads every day. After 4 weeks, she reported that the morning stiffness in her hands, which used to make writing difficult, was almost entirely gone. Parsley is absolutely loaded with vitamin K and a specific type of antioxidant called apigenin. Vitamin K is essential for bone health, helping to regulate calcium and ensuring it goes into your bones, not soft tissues or joints. But the real star is vitamin C. Parsley is an incredible source of vitamin C, which is not just for immunity, it is the non-negotiable cofactor for the body to synthesize collagen. Think of collagen as the primary protein scaffolding of your cartilage. Vitamin C is the foreman of the construction crew, directing the entire operation to rebuild and repair. A study in the Journal of Orthopedic Research in 2011 confirmed the critical role of vitamin C in collagen synthesis and its potent effect on maintaining cartilage health and structure. Practical guide: how to. Dosage: use a half cup of fresh, packed parsley leaves daily. Golden time: best eaten raw, like in a salad, pesto, or blended into a smoothie, to preserve the vitamin C. Notes: don't just sprinkle it. Make a parsley-heavy tabbouleh or blend it with your EVOO, solution 4, to make a potent dressing. Will you start treating parsley like a vegetable instead of a garnish? Solution 8, the sweet joint lubricant, Tart cherries. Our final food is a slightly tart, incredibly effective fruit, especially for those suffering from joint flares, Tart cherries, also known as Montmorency cherries. George, a 65-year-old man who loved hiking but suffered from occasional agonizing gout flares in his big toe, started drinking Tart cherry juice nightly. After 1 month, his flares dropped dramatically. His general joint soreness also subsided, reporting that his knees felt better lubricated when walking. Tart cherries contain high levels of anthocyanins, similar to the black beans, but a particularly potent form. These compounds are responsible for the fruit's deep red color and act as incredibly strong antioxidants. They specifically target and reduce the production of uric acid, the compound responsible for the fiery pain of gout. But for general pain, they significantly lower systemic oxidative stress, acting like a sweet lubricant that calms the entire joint environment and improves overall mobility. A study published in the Journal of the International Society of Sports Nutrition in 2010 found that consumption of tart cherry juice significantly reduced muscle damage and pain following strenuous exercise, directly showing its potent anti-inflammatory and pain-reducing properties. Practical guide: how to. Dosage: drink a half cup of unsweetened tart cherry juice or eat 1 cup of frozen/fresh tart cherries daily. Golden time: drink the juice in the evening. The anthocyanins also naturally contain melatonin, which can aid in sleep, and a body that sleeps well heals well. Notes: must be unsweetened. Added sugar is pro-inflammatory and will cancel out the benefits. Look for 100% Montmorency tart cherry juice. Have you ever tried tart cherry juice for sleep or pain? You have now been armed with the knowledge of 8 potent, science-backed foods, not drugs, that can fundamentally change the destiny of your joints and your life. Let's quickly summarize the 2-step strategy. 1. Stop the fire. Use turmeric, EVOO, fatty fish, and tart cherries to aggressively shut down the chronic systemic inflammation that is attacking your cartilage. 2. Rebuild the structure. Use pineapple, black beans, broccoli, and parsley to supply the necessary enzymes, vitamins C and K, and antioxidants needed to clean up debris and synthesize new, healthy collagen. This is not a quick fix. You won't feel better tomorrow morning. But I promise you, with consistency, your body will respond. It wants to heal. Give it the tools it needs. My final advice is this: start small. Pick just 3 of these foods that you enjoy and commit to incorporating them every single day for the next month. Don't let the simplicity of this approach fool you into thinking it's not powerful. It is, in fact, the most powerful and sustainable path to health. Your independence is too precious to lose. Your freedom of movement is your greatest asset. Do not give it up to a diet of convenience and pro-inflammatory foods. Take back control, starting today. If this video gave you hope, if it armed you with new, actionable knowledge, then please do me a favor. Hit the like button, and more importantly, subscribe to this channel and turn on notifications. You don't want to miss our next video, where I dive into the 3 morning mistakes that are sabotaging your collagen. Thank you for trusting me with your health journey. I'm Dr. David Thompson, and I look forward to seeing your success story in the comments.